Good day po. So, ngayon po, sabayan niyo po ko sa ating Cclec-Notes. Number 1, descriptive statistic. Measure of center. We have the mean, median, and mode. Measure of spread, range, standard deviation, coefficient of variation. Please take note, the smaller the standard deviation, the greater the precision. The smaller the CV, the greater the precision. For measure of shape, the most commonly used is the Gaussian distribution, also known as the normal distribution. Huwag po natin kakalimutan, we have yung t-test at saka yung f-test. For t-test, ano pong kino-compare nito? Accuracy at saka mean. For f-test, we have precision and standard deviation. Huwag pagpapalitin, magkaiba po ang analytical sensitivity from diagnostic sensitivity. At magkaiba rin po ang analytical specificity from diagnostic specificity. Huwag pong kakalimutan pag sinabing analytical sensitivity, ability of a method to detect small quantities of the analyte. Analytical specificity, ability of a method to detect only the analyte of interest. Magkaiba po ito pag sinabing diagnostic sensitivity, diagnostic specificity. Pag sinabi pong diagnostic sensitivity, ability of the test to detect a given disease or condition. And diagnostic specificity, ability of a test to correctly identify the absence of a given disease or condition. Nung sudan po ako, ang palatandaan ko po dito, ang acronym na NP. Kasi pag diagnostic sensitivity, referring sa mga true, positive, at diagnostic specificity, referring sa mga true, negatives. NP. Ang partner ng N letter P, sensitivity referring sa true positive, specificity referring sa true negative. Pero huwag pong kakalimutan yung formula to compute for sensitivity and specificity, gayon na rin po sa mga predictive values. When we say positive predictive value, chance of an individual having a given disease or condition if the test is normal. Negative predictive value, chance an individual does not have a given disease or condition if the test is within the reference interval. Westgood rule, mga habilin po, lahat po sila rejection rule, except yung 1:2S, 1 control value exceed the plus or minus 2SD. Kasi yung 1:2SD, warning pa lang po ito. Yung 1:3S at saka 4S, this indicate what type of error? A random error. Now yung 2:2S, 4:1S, and 10 to the mean indicates as a systematic type of error. Huwag din po sanang kakalimutan yung definition ng trend at saka shift. Pag sinabing trend, gradual change in the analytic process. Pag sinabi pong shift, abrupt change in the analytical process. What is the main cause of trend? Deterioration of reagent. What is the main cause of shift? Improper calibration of the instrument. Another parang local boards or local review, huwag pong kakalimutan yung mga classification of hazard by the NFPA, National Fire Protection Association. Blue diamond for health, red diamond for fire, yellow for activity, and white for specific hazard. Nandito po yung mga grading sa page 2, pero okay na po kapag alam nyo, blue diamond health, red diamond for fire, yellow reactivity, and white for specific hazard. Huwag din po sanang kakalimutan, in case of fire, ano pong gagawin natin? Appropriate gawin. Yung acronym na RACE, rescue, activate the alarm, contain and extinguish. Paano naman mag-operate ng fire extinguisher? Huwag pong kakalimutan yung pass. Pull the pin in the nozzle, squeeze the trigger, and then sweep. For Class A, fire extinguisher, para saan po ito? For ordinary combustible. Pag sinabi pong ordinary combustible, ano po ito? Yung mga wood, paper, tsaka cloth. Class B for flammable liquid or organic chemical, gasoline paint, for C, electrical equipment fire, motors, switches. Class D, Class D, we have yung mga flammable metal. For example, magnesium. Class E, arsenal fire. Ano po ito yung mga ammunition? They cannot be extinguished. Ano pong ginagawa dito? Dinidetonate or kaya they are allowed to burn out nearby materials protected. Number 3, huwag pong kakalimutan, pag sinabi pong uremia, abnormally high urea nitrogen in blood. Azotemia, according to Turgeon, an increase in urea and creatinine. What are the 3 categories of azotemia? Pre-renal, bago mag-kidney, renal the kidney, post-renal, after ng kidney. Pag sinabing pre-renal, azotemia, poor perfusion to the kidney. Renal azotemia, type of azotemia associated with diminished glomerular filtration, and post-renal azotemia resulting from obstruction. Number 4, huwag pong kakalimutan yung bilirubin. We have yung B1 or the unconjugated bilirubin, also known as the indirect reacting bilirubin. Bakit po siya tinawag na indirect reacting bilirubin? It will not directly react with the color reagent. It must be first dissociated from its protein component. B2 or conjugated bilirubin or the direct reacting bilirubin, it will directly react with the color reagent. In hemolytic jaundice, remember, elevated po yung B1. In hepatic jaundice, elevated po yung B1 and B2. But in bile duct obstruction, elevated lang po yung B2. Hemolytic jaundice, elevated lang po yung B1. Biliary obstruction, obstructive jaundice, B2 only. In hepatic jaundice, both B1 and B2. Kanina po na-mention ko yung B1, unconjugated bilirubin or indirect reacting bilirubin. Bakit po? Because it will not directly react with the color reagent. It must be first dissociated from its protein component. Sa Evelyn Maloy po, ano pong dissociating agent? Yung ibang libro po, ang tawag po dito, accelerator. So sa Evelyn Maloy, ano po yung dissociating agent or accelerator? Methanol. Sa Jendrasik and Groff, ano po yung dissociating agent or accelerator? Caffeine, sodium, benzoate. Ngayon, ano po nakita natin sa number 5, yung mga different electrophoretic pattern. Unahin po na natin yung letter A. At pH of 8.6, proteins are negatively charged. They migrate towards the positive electrode. Most nodal fastest migrating protein is albumin. Next to albumin, we have alpha-1. Alpha-1, alpha-2, beta, at saka gamma-glob. Sa figure B naman po, nakita po natin there is, yun po ulit, albumin, alpha-1, alpha-2, beta, at saka gamma-glob. So dito po, may gamma spike. Elevated po yung gamma globulin. Now, this can be seen in multiple myeloma. Another po, we have in C, alpha-1 antitrypsin deficiency. Kung mapapansin, depressed po yung alpha-1 globulin. Now, example of condition with depressed alpha-1 antitrypsin, huwag pong kakalimutan, emphysema. Now, figure C po, cirrhosis. In cirrhosis, mababa ang lahat ng protein except for alpha-2 globulin. Remember, ang cirrhosis po is associated with massive proteinuria, maraming protein sa urine. Anong effect nito sa serum protein? Mababa. Mababang albumin, mababang alpha-1, mababang beta, mababang gamma-glob. Pero ang excretion ng protein relative to their sizes, hindi agad-agad na ilalabas ang alpha-2, particularly yung alpha-2 macroglobulin. Kasi bakit? Kasi malaki, hindi agad-agad na ilalabas sa katawan. So pag tinanong po tayo, a condition with elevated Serum alpha-2 macroglobulin, huwag pong kakalimutan, nephrotic syndrome. In inflammation, kung mapapansin elevated, yung alpha-1, alpha-2, bakit po kasi elevated po yung mga acute phase reactant? Ngayon, paano po i-differentiate ang acute from chronic inflammation? Huwag pong kakalimutan, gamma globes. In chronic inflammation, elevated na po yung mga gamma globulins. Bakit? Kasi may production na po ng mga immunoglobulins. In cirrhosis, huwag kakalimutan, continuous ang beta sa gamma region. Beta-gamma bridging effect found in cirrhosis. In cirrhosis, elevated po ang lahat ng immunoglobulins. Pero, ano po yung immunoglobulin responsible sa beta-gamma bridging effect found in cirrhosis? IgA. Yung mga immunoglobulins po ang dating tawag sa kanila ay gamma globes because most of them migrate sa gamma region, but not all of them migrate sa gamma region. So, instead of naming them as gamma globulin, tinawag na po silang immunoglobulins. Ano po yung proof nito? Ito po, yung IgA migrate sa slow beta region. In cirrhosis, tataas lahat ng immunoglobulin. Immunoglobulin including IgA. So pag ito po tumaas, magiging continuous ang beta sa gamma region in cirrhosis. Huwag pong kakalimutan. Just a review ng ating pong discussion. We have yung gamma spike in multiple myeloma, depressed alpha-1 globulin, for example, depressed in alpha-1 antitrypsin in patient with emphysema, elevated alpha-2 macroglobulin, depressed ang lahat ng protein except for alpha-2 globulin, particularly yung alpha-2 macroglobulin in nephrotic syndrome, spike in alpha-1, alpha-2 beta, in inflammation again. Paano i-differentiate ang chronic inflam from acute inflam? In chronic inflam, elevated na rin po yung mga gamma globulins kasi may production na po ng antibodies. Beta-gamma bridging effect is seen in what condition? In cirrhosis. Ano po yung responsible sa beta-gamma bridging effect found in cirrhosis? IgA. Huwag pong kakalimutan. Another, we have yung 4 major lipoprotein, chylomicrons, major carrier of exogenous or dietary triglyceride, VLDL, major carrier of endogenous or liver synthesized triglyceride, LDL, major carrier of cholesterol, and HDL for reverse cholesterol transport. Huwag pong kakalimutan. Hindi po kompletong ating exam pag hindi po tinanong yung mga different types of hyperlipoproteinemia. In type 1 po, elevated po ang triglyceride kasi elevated po ang chylomicrons. Type 2A, elevated po ang LDL. Type 2B, elevated po ang LDL at saka VLDL. Type 3, elevated po ang beta-VLDL. Huwag kakalimutan, ang beta-VLDL is also known as a floating lipoprotein. In type 4 hyperlipoproteinemia, elevated po ang VLDL. In type 5, elevated po ang VLDL at saka chylomicrons. Baka po maitanong after a meal, lipemic yung plasma. Ano pong responsible dito? Triglyceride. Pag wala pong triglyceride, pwede po tayong sumagot ng chylomicrons or lipoprotein. Remember, major carrier of exogenous or dietary triglyceride, chylomicrons. Huwag din pong kakalimutan yung Friday-Wald equation to compute for the value of LDL cholesterol. LDL cholesterol is equivalent to total cholesterol minus HDL cholesterol minus the VLDL cholesterol. How do we compute for VLDL cholesterol? In mg per deciliter, triglyceride divided by 5. In millimole per liter, triglyceride divided by 2.175. Huwag rin po sanang kakalimutan yung differentiation ng type 1 and type 2 DM. Yung type 1 DM, insulin dependent, common po sa mga patient less than 20 years old. Kaya nga po siya tinatawag din na juvenile onset diabetes mellitus. It accounts only for less than 10% of DM patient. Ketone bodies are usually seen. They are rare po ang obesity sa type 1 in contrast with type 2. Serum insulin is very low due to pancreatic beta cell destruction. The condition is characterized by absence of insulin and very low or undetectable C-peptide. In type 2, common sa mga adult, non-insulin-dependent DM, sa mga adult over 40 years old, kaya tinatawag din na adult onset diabetes mellitus. Yung type 1 po, juvenile onset DM. Common type of DM, common po dito ang obesity. Ang insulin po dito, normal or high, at ang C-peptide detectable. Mga habilin, wag pong kakalimutan itong mga values na to kasi useful po. I-memorize po yung mga normal values, yung mga values indicative of impaired glucose status, at yung mga values po indicative of DM or diagnostic for DM. Huwag kakalimutan po. For monitoring of patient with DM, we have yung glycosylated hemoglobin for long-term monitoring of DM patient. So kapag may DM po na minomonitor, ang okay na value nito ay dapat pong bumababa sa 6.5%. Bakit? Kapag mataas pa rin, ibig pong sabihin, hindi nagre-respond ang patient mo sa treatment or kaya hindi fina-follow yung diet na sabi ng doktor. Huwag kakalimutan yung glycosylated hemoglobin is affected by the red cell survival. So, yung mga condition associated with hemolysis, decrease po ang glycosylated hemoglobin. Unlike with fructosamine, remember, fructosamine, short-term monitoring of DM patient, glycosylated albumin, a reflection of her glucose for 2 to 3 weeks. Ang fructosamine, unlike your glycosylated hemoglobin, is unaffected by hemolysis. So kapag may patient po tayo na may DM at nagsasuffer din po from hemolytic anemia, ano po yung best way to monitor this patient? Fructosamine. Inuulit ko po, yung glycosylated hemoglobin affected by RBC survival. So kapag may hemolysis, decrease ang glycosylated hemoglobin. Na pag ganun po, paano i-monitor itong patient na to? Fructosamine. Sa number 8 po, nakita po natin yung mga different clinical enzymes and their clinical significance. So maging familiar po dito. Huwag din po sanang kakalimutan, ito po ang pseudocholinesterase deficiency. Pseudocholinesterase deficiency causes an increased sensitivity to certain muscle relaxant, called choline ester. Affected individuals may suffer from prolonged apnea and muscle paralysis. Pseudocholinesterase deficiency. Huwag din sana pong kakalimutan, in myocardial infarction, nung student po kami, ano pong palatandaan natin dito? Huwag kakalimutan yung may tropical. First analyte to be elevated is myoglobin, pero ang elevation po ng myoglobin is non-specific. Remember, it can also be elevated in muscle disease. Troponin, huwag kakalimutan, ang troponin po is considered as the gold standard for diagnosis of acute coronary syndrome or myocardial infarction. And kapag na-mention po yung enzyme, huwag kakalimutan according to their onset of elevation, we have CK, AST, at saka LD. Maging familiar po dito. Sa number 11 na-mention po dito, yung mga different electrolyte and yung mga condition associated with increase or decrease values. Huwag kakalimutan, remember, in the investigation of hypo and hypernatremia, ang next activity is to measure the osmolality. Ano pong nakita po dito sa notes? Sa number 11, yung mga condition po associated with hypernatremia. Kung may papatandaan din po ako, huwag kakalimutan yung equivalent urine osmolality. In dehydration, increased sodium, increased urine osmolality. In diabetes insipidus, increased sodium, low osmolality. In Cushing's disease or Cushing's syndrome, hypernatremia associated with normal urine osmolality. Next, sa page 6 po ng notes natin, nakita po natin dito yung mga condition associated with hyponatremia at yung corresponding urine osmolality. Bigyan ko lang po ng emphasis yung syndrome of inappropriate ADH secretion or ADH production. In syndrome of inappropriate ADH production, depress po ang sodium, depress din po ang serum osmolality, pero elevated ang kanyang urine osmolality. Inuulit ko po, syndrome of inappropriate ADH production, hyponatremia, hypoosmolar, but with an increased urine osmolality. Mababa po ang serum sodium, mababa po ang serum osmolality, pero elevated po ang urine osmolality. Huwag pong kakalimutan. Paano naman po ito? Pseudo-hyponatremia. Huwag kakalimutan, elevated lipid or elevated protein is associated with pseudo-hyponatremia. Ano pong affected dito? Yung mga test po na dinadilute ang patient serum like flame photometry, indirect ISE. Not affected po yung mga test na hindi dinadilute ang patient serum. So, direct ISE. So, between indirect and direct ISE, which one is more accurate? Direct ISE, bakit? Because in direct ISE, patient's serum is undiluted. So, ano pong situation dito? Normal ang osmolality pero depressed ang sodium. This can be indicative of pseudo-hyponatremia. Due to increased lipid, increased protein, ano pong affected dito? Flame photometry, indirect ISE, yung mga test na dinadilutan serum. Unaffected po yung direct ISE kasi undiluted ang serum. Between direct and indirect ISE, mas accurate po yung direct ISE. Pero hindi po lahat ng situation na mababa ang sodium, normal ang osmolality, ay pseudo-hyponatremia. Now, this can also be indicative of acute hyperglycemia. So, ano naman po ang weight para ma-confirm ito? To check for the glucose. So, in excess lipid, increased protein, anong pinaka-next na move dito? Measure sodium with direct ISE. Inuulit ko po, walang sasagot ng indirect ISE or kaya to check for glucose. Serum sodium decreases by 1.6 millimole per liter for every 100 mg per deciliter rise in serum glucose. Huwag din po sanang kakalimutan yung mga formulas to compute for the osmolality. Ano po pong nakita yung mga condition associated po with increase or decrease potassium, condition po associated with increase or decrease chloride. Another, we have yung bicarbonate and magnesium. Huwag kakalimutan po ito. Ang magnesium sulfate can be used therapeutically with preeclampsia, cardiac arrhythmia, myocardial infarction. Yung magnesium sulfate. So, magnesium sulfate is a vasodilator. It decreases the activity of the uterus in eclamptic state and increase the blood flow in the uterus. However, itong therapy with magnesium sulfate can lead to increased magnesium or hypermagnesemia. So, sa mga patient receiving magnesium sulfate, dapat din pong minomonitor yung magnesium level. In pre-eclampsia, magnesium therapy can lead to neonatal and maternal hypermagnesemia. Ano pa pong nakita sa notes yung mga condition associated with elevated calcium? Huwag kakalimutan ito po. Ano po yung condition with elevated calcium, elevated parathyroid hormone? Yung mga disorder of parathyroid gland like parathyroid adenoma or parathyroid carcinoma. Pero huwag kakalimutan, ano pong condition to? May increase po yung calcium, mababa o normal yung parathyroid hormone. Wala pong kinalaman sa parathyroid gland to. This can be seen in metastatic cancer or in patient with multiple myeloma. So, huwag kakalimutan, high calcium, normal to low, parathyroid hormone, metastatic cancer, multiple myeloma. Another, huwag kakalimutan, yung formula to compute the anion gap, pwede po itong i-compute ng meron or walang value ng potassium. Condition with increased anion gap, huwag kakalimutan mud pile, methanouremia, diabetes, ketoacidosis, paraldehyde, iron, inhalant, isoniazid, ibuprofen, alpha-lactic acidosis, ethylene glycol, ethanol, and salicylate, starvation, ketoacidosis. Kung may papatandaan po ko, hindi na po kasali dito yung paraldehyde kasi wala na po commercially available paraldehyde. Number 13, mga normal values. Ang patatandaan ko po dito yung blood pH. What is the normal value for blood pH? 7.35 to 7.45, lower than 7.35 acidemia, and greater than 7.45 alkalemia. Huwag pong kakalimutan yung PCO2. Normal value, 35 to 45 millimeter mercury. Huwag kakalimutan, yung PCO2 electrode is actually a pH electrode. Anong minimeasure po nito? pH. Bicarbonate, normal value for bicarbonate, 22 to 26 millimole per liter. Another specimen when exposed to air. This will promote entry of oxygen. So, elevated PO2, depressed PCO2, depressed carbonic acid, so alkaline elevated pH. So increased PO2, decrease PCO2, decrease carbonic acid, decrease acid would mean an alkaline pH. Specimen ng room temp, ito naman po yung sa closure. Now, ang oxygen, will be utilized by cell. So decrease PO2, this would mean an elevated PCO2, increased carbonic acid. Kapag increase pong carbonic acid, yung pH po acidic or decreased pH. Huwag mong kakalimutan. Another, tuturuan ko po kayo mag-solve ng mga condition involving the acid-base disorder. Pag binigyan po ng mga values, huwag matatense. Ang una pong tingnan yung pH. Normal pH, blood pH is 7.35 to 7.45. Less than 7.35 acidosis, greater than 7.45 alkalosis. Another, ang after ng pH yung next, titingnan nyo po yung PCO2. Remember, for PCO2, normal value is 35 to 45 millimeter mercury. Kapag ang normal po ito, ang PCO2, ibig sabihin respiratory disorder. Ang PCO2 po ay opposite ng pH. So, decreased pH, elevated PCO2, respiratory acidosis, increased pH, decreased PCO2, respiratory alkalosis. Paano po pag normal ang PCO2? Check po yung bicarbonate. Normal value for bicarbonate is 22 to 26 millimole per liter. So, kapag ang normal po yung bicarbonate, metabolic disorder po ito. Ang bicarbonate at saka pH, same side. So, decrease pH, decrease bicarbonate is metabolic acidosis. Increase pH, increase bicarbonate, metabolic alkalosis. Maging familiar po. Another, we have yung mga different hormones. Number 14, the endocrine gland and the hormones that they produce. Lilinawin ko po, yung posterior pituitary gland, hindi po siya producer ng hormone. It only acts as storage for hormones produced by the hypothalamus. Number 15, we have the thyroid function test. The initial best screening test is TSH. Kapag abnormal po ang TSH, tsaka po tayo magpo-perform ng test for free T4. Abnormal lang po yung test for free T3 kapag hindi expected yung result ng free T4. Inulit ko po, initial best screening test for thyroid disorder is TSH. Kapag abnormal po to, tsaka po tayo magpo-perform ng test for free T4. Optional lang po yung test for free T3 kapag hindi expected ang result ng free T4. Maging familiar po dito. Kung may papatandaan po ko, wag po itong kakalimutan. In primary hypothyroidism, ang defect po nito nasa ating target gland, nasa ating thyroid. So mababa ang T3, T4. This will signal the anterior pituitary gland to raise or to increase its production of TSH. Secondary hypothyroidism, mababa ang T3, T4 kasi ang defect po nasa TSH. Pag sinabi pong secondary, ang defect po nasa anterior pituitary gland. Mababa ang TSH, kaya mababa ang kanyang T3, T4. In hyperthyroidism particularly, in primary hyperthyroidism, mababa ang hyperthyroidism elevated, yung kanyang T3, T4. Now, this will signal the pituitary gland to stop its production of TSH. Primary hyperthyroidism, mababa ang kanyang T3, T4. This will signal the pituitary gland to stop its production of TSH. Ang tawag po natin dito ay negative feedback mechanism. Huwag pong kakalimutan ng Cushing syndrome. Pag sinabing Cushing syndrome, elevated po ang kanyang cortisol. Kahit ano pong cause. Meron po tayong tinatawag na adrenal Cushing syndrome. Ang defect po nasa mismong adrenal gland, sa adrenal cortex. Pituitary Cushing syndrome, ito po ang defect nasa pituitary gland. Mataas ang kanyang TSH, kaya mataas ang cortisol. And yung mga tumors na nagpo-produce ng ACTH. Kanina po na-mention ko, yung adrenal Cushing syndrome, kung baga ito yung primary, ang defect po nasa kanyang adrenal cortex. Mataas ang kanyang cortisol, this will signal the pituitary gland to stop its production of ACTH. Huwag pong malilito, pituitary Cushing syndrome, mataas ang kanyang cortisol kasi mataas ang pituitary production ng ACTH. Huwag kakalimutan, adrenal Cushing syndrome, high cortisol, low ACTH, pituitary Cushing syndrome, high cortisol, high ACTH. Huwag pong kakalimutan, yung pituitary Cushing syndrome is also known as the Cushing's disease. Pinaka-favorite ko po itong dexamethasone suppression test. After the test, kapag mataas pa rin po yung cortisol, pwede po itong adrenal Cushing syndrome or ectopic production of ACTH. Ito pong test na to ay pwedeng gamitin to differentiate Cushing's disease from adrenal Cushing syndrome and ectopic ACTH production. Because in Cushing's disease, after the test, bumaba po yung kanyang cortisol by 50%. Pag wala pong change, adrenal Cushing syndrome or ectopic ACTH production. Pag bumaba po ang cortisol after dexamethasone, ibig pong sabihin by 50%. This is an indication of pituitary Cushing syndrome or Cushing's disease. Huwag kakalimutan kapag na-mention po ang TDM, ang preferred sample po dito is plasma or serum. After po tayo kasi sa concentration. Unless ma-mention po si cyclosporine at saka tacrolimus. Pag po iyon na-mention, ang preferred sample po doon ay whole blood. Peak, pinakamataas, kailan kinukuha po yung sample dito, depende sa administration when given intravenously, 30 minutes after IV, 60 minutes after IM, administration 1 to 2 hours after oral intake. Yung lowest naman po, kailan po siya kinukuha? No? Immediately before the next dose. Nakita po sa page 17, yung mga different action or yung mga different drugs and the condition na they treat. We have yung mga cardiotropic to monitor to treat patient with congestive heart failure and cardiac arrhythmias, anticonvulsant, anti-epileptic, to treat seizure, anti-asthmatic drug, bronchodilator, anti-neoplastic for treatment of cancer, immunosuppressive drug, to depress the immune system, immune reaction, analgesic to relieve pain, and the psychoactive drug. Example ng psychoactive drug is lithium to treat bipolar disorder or manic depression. For TDM, ang preferred sample po natin, serum or plasma. Take note, unless ma-mention po yung cyclosporine at tacrolimus. Kapag po na-mention to, ang best sample po dito, whole blood. Prokinamide, a cardiotropic, cardioactive for treatment of congestive heart failure. Ano pong metabolite ng prokinamide? NAPA. Ang kwento po dito, yung patient nag-exhibit ng toxic reaction ng prokinamide pero normal ang prokinamide values. So, what to do next? Pwede po nating i-assay ang NAPA. Baka naman nag-metabolize na si prokinamide to NAPA or N-acetyl prokinamide. Another, we have primidone, an anticonvulsant, anti-epileptic for treatment of seizure. Ano po yung metabolite for primidone? Huwag kakalimutan, isa sa mga metabolite nito, phenobarbital. Yun ulit yung patient nag-exhibit ng toxic reaction to primidone. Anong pwedeng gawin? Pwedeng i-measure or i-assay ang phenobarbital kasi ang phenobarbital is a metabolite of primidone. Salamat po. Hanggang dito po muna ulit. Thank you.